Good morning.
Good morning, Mayor McClure, members of council. Just as a reminder to those viewing, I removed my mask as a courtesy to those that rely on lip reading as a form of communication. On Friday, we added a record one-day addition of 203 cases of COVID-19 in Greene County residents. In the days following, that number has gone up and down from 89 on Saturday, 122 on Sunday, and 82 yesterday. And while these numbers certainly weren't what we wanted to see, they're also not completely surprising. When you bring around 20,000 plus college students to a community, you're going to have some disease spread. Some of them brought disease with them. Some of them contracted the illness here. Of the cases we've added in August, 36% were in the 18 to 22 age demographic. And just looking at the last week, 58% of our new cases were in that age group. While I do consider this growth concerning, and my staff continue to watch this situation closely, we're still looking for trends to inform our path forward. And I wouldn't consider what we're seeing to be exponential growth at this time. I want that age group to know that they really control their own destiny going forward. How seriously they take this disease and mitigation measures are going to maintain what or what they need to maintain what the semester looks like going forward for them. These students are doing the right thing at school, they're doing the right things at work, but it's the time in between that we seem to find a devil-may-care attitude. I also want you to know that it's not just your destiny you control moving forward. There are ripple effects for all the people in your life. If you test positive, you're sitting at home for 10 days. If you can't work for 10 days, you aren't making money. And if you've exposed your coworkers, they're sitting at home quarantined for 14 days, not making any money. Your employer will have to operate with fewer staff, and that can impact their bottom line as well. Your roommates or other close contacts are quarantining at home for 14 days, and I want to emphasize this especially with the upcoming Labor Day holiday, with many people getting together with family and friends. If you expose your loved ones, your parents, your grandparents, or other family members who might have risk factors, they could have much worse health consequences than you do. I also want you to get the impression that this, let me repeat that, please. I also don't want you to get the impression that this age group's health is universally unaffected by COVID-19. Most people in this age group will fully recover, but while it's not especially common, we have seen national evidence of negative long-term outcomes in young adults. Reports of strokes and blood clots are something to take very seriously. I hope you hear with all sincerity that we want you and the people you love and care about to be healthy, and we need your help in this. We need you to sacrifice a bit. I know we've asked a lot of you, and we've asked a lot of our community, and I know that you probably didn't get the high school graduation you wanted, and I know that many of you aren't having the college experience that you wanted, but I will ask again that you get creative about the experience you can safely have, that you use technology to make connections and build your future, and that you find ways to stay in touch with friends and loved ones at a physical distance, that you wear a mask when distance isn't an option, and that you do everything you can to not contract this illness. Be happy to take any questions that you might have.
Thank you. What questions are there for Mr. Goddard? Mr. McGowan.
Yes, thank you, Mayor. I would like to, I know you mentioned trends, and we're all looking for trends on how we're doing, or how well we're doing in terms of the masking and other things we're taking and mitigation measures we're taking. One of the questions that could help us understand whether or not we're doing a good job is the positivity rate. Is there a way we can get on a weekly basis a positivity rate? If we can't, tell me why we can't get that.
We're working on putting that metric out there. Now, unfortunately, like much in this pandemic, it's not as easy as it seems. Let me explain further what I mean. The positivity rate's calculated by the number of positive tests divided by the total number of tests given. The problem that we encounter is that positive tests are required to be reported within 24 hours. That's part of the nature of the urgency of that disease report. But what we're finding is that negative tests oftentimes take several weeks to be fully reported out. So what happens is that lack of negative test results end up skewing that number right out of the gate. Now, let me give you an example. We're confident that there was a 9.02 positivity rate for the week of August 9th through 15th. But early on in that week, that number was more than 25% because negative results weren't coming in through the state's reporting system. So 2 weeks later, it drops from 25% to 9%.
Okay.
And what we worry about is we're kind of stuck between a rock and a hard place. We put the data out real time, people panic. If we don't put the data out real time, people accuse us of hiding things. So I think we're trying to find ways that we can asterisk that data and continue to update it. But it's not really good actionable data until you have the full picture. And so that's the situation that we find ourselves stuck in.
So there's essentially a two-week lag between getting the negative back.
What we found is it takes up to 2 weeks before we really have a stable positivity rate. And, you know, there are entities that are reporting it out real time, but that's still not a clear picture that we would rely on from an analytics perspective.
Now, based upon you said 2 weeks ago it would have been 25%, and you said now is you looked at those numbers based upon the negatives you received, it was 9%. Mm-hmm. Comparing that number, did you go back and see if we're trending up or down?
Definitely trending up. The week before we were about 4.5%.
Okay.
So it doubled in that time frame. And that is not necessarily surprising given what we've seen with case numbers. I would guess that we're somewhere in the 10% range right now.
Okay. Thank you.
Mr. Simpson?
Thank you, Clay. Thanks for your report as always. Just a few questions. One, you mentioned the growth trend in cases among individuals who are 18 to 22 years old, that we were at, I think you said about 36% for the month of August, and that had risen to 58% for just the last week alone. How does that for the percentage for the week and the month compare to July and June and earlier months in that age group?
So excellent question, and we're going to be releasing a graphic via social media platforms. It might be out by now, that will show you the 7-day rolling average for all cases, those that happen in institutional settings such as long-term care, then the community minus long-term care in institutions, as well as minus 18 to 22. We also graph out the 18 to 22. And not surprisingly, about August 20th, you see that 18 to 22% significantly increase. So that falls in line with arrival of students and wouldn't be a surprise for us. But I think that graphic will answer a lot of your questions, and feel free to reach out to me if there's any ambiguity after reviewing that.
Thanks. I think that would be very helpful to help kind of see what is driving this growth. It seems like recently it's been primarily that 18 to 22 age group. You mentioned institutional settings as something else graph. I think will be very helpful to see. Just on that, I know we've talked lately a lot about the situation at the jail. Do you have any updates there for us?
No, it seems like we're still getting some out of long-term care facilities and a smattering out of the jail, but not as significant as it was in late July and through middle of August. There is a rule change that CMS has implemented that is due to go into effect in communities where there's a greater than 10% positivity rate. Long-term care facilities are going to be required to test their staff twice a week, and we think that that will probably have a huge impact on reducing case transmission, because we know that those cases are being imported in with unknowing staff. So that should help in those settings significantly.
Thanks. And the last question I have, and this is a continuation of a theme. I appreciate you continuing providing updates on these, but with the rapid saliva tests, particularly the Washington University method receiving FDA emergency approval, do you have any updates on our capacity to be able to use those tests locally?
It's in process, so it would be premature to make an announcement, but I can tell you that we're making traction on local ability to stand that bandwidth up. So as more concrete details come in, I think you'll have some good news in that arena.
Thank you very much.
Mr. Hosmer?
Clay, you said that 58% of the positive cases last week were from the 18 to 22-year-old?
That's correct.
I mean, it's obviously clear to you that that's coming from the students returning for colleges and universities.
Undoubtedly, it's not all of them are enrolled in college, but a significant number likely are.
And I know that our masking ordinance essentially exempted the colleges and universities in the city and also the elementary and secondary schools to allow them to set their own policies. But in response to these numbers, could you remind us what the universities and colleges essentially are doing to mitigate, and then also what the elementary and secondary schools are doing?
All of higher ed is requiring masking on campus, indoors. They've also taken measures to reduce densities by providing hybrid classes, moving some of the students to online sessions in a mix with seated sessions. And SPS has a universal masking requirement for people who are attending classes on campus. So what we're finding, Councilman Hosmer, is that this is probably less to do with what happens on campus and more to do with what happens off campus. And I don't know if you remember what it was like to be in that 18 to 22-year-old
Barely.
cohort. I do, and I felt I was bulletproof, and I don't think that people in this age group are fully comprehending the consequences. What I'm hoping will happen is, now that they're finding out that I was at that party and now I'm quarantined for 2 weeks in the hotel or elsewhere, that there are consequences to some of those reckless behaviors. What we're finding with younger folks, sub 30, is that they're much more likely to engage in what we would call higher risk activities, going to parties, going to group events, and things that really a mask ordinance would not impact.
Are we seeing a rise in positivity or positive cases for elementary and secondary age schools?
Not yet. Of course, SPS would have gone into session last week, so we'll be watching those metrics very closely this week.
So it seems like the concern right now is the college age spread.
It is, yes.
Is there anything that the colleges and universities are looking at doing differently? Because obviously if what they're doing, either one isn't working or isn't being followed, even if it's off campus, it seems like some universities, I think, have gotten, nationally at least, have gotten a little bit more restrictive on what students can do both on and off campus, and I wonder what our colleges and universities are doing.
I can't speak for the university presidents at this time, but I know that they have a vested interest in trying to keep their campuses open. So we're continuing to work with them, trying to develop an epidemiological profile for these cases, bringing in some additional assets to help with case investigation and with the contact tracing piece. And as we develop trends, that helps inform paths forward. Right now, there are few clusters of illness, so trying to find what the root cause is has been a challenge.
And are you finding relatively good compliance with the masking requirements while people are in bars or?
So, Paul Williams and PD does those compliance checks, and I find what they find is that they're meeting the density restrictions, which are at 50%, but oftentimes if they get a drink in hand, the mask comes off, and because that's as the ordinance stipulates, but I don't have evidence yet to tie this to nightclubs or bars, so that would simply be a leap that I would have to take to say that that's a cause of
Thank you.
concern.
Are there other questions? Well, thank you for your continued work and the diligence of your staff during this time. It's a trying time, and we're grateful for your work.
Thank you, Mayor. Let's keep smiling. We'll get through this together.
Thank you, sir.